Attention deficit and hyperactivity disorder affects children and adults. Prescription drugs are one form of treatment. Many college students know what it takes to get those drugs prescribed. Psychiatric nurse practitioner Nicole Wilson works with college students with ADHD and also knows how the prescription drugs are abused. Thanks for coming on the show today.
Thanks for having me.
Can you describe ADHD first of all for me? What are the symptoms?
Sure. So ADHD is a neurodevelopmental disorder with the primary symptoms being inattention, impulsivity, and hyperactivity. Not everyone meets criteria for all of those, but those are the primary symptoms that you'll see.
Okay. Is this something that is just increasing, the number of cases?
What we see in terms of prevalence, a lot has changed in terms of our understanding of ADHD. Diagnostic criteria have changed over the years, and also practitioners have become more adept at identifying it, so you'll see prevalence numbers increase. And we just are starting to realize that symptoms and impairment continue into adulthood, whereas we used to feel that it was a child-adolescent disorder.
Now, you're talking about diagnosing ADHD. How do you diagnose?
So diagnosis generally, it depends on what stage you're noticing symptoms at. Children are often identified in a school setting where teachers will realize that they're having problems performing or they're having problems sitting still and they're interrupting in the classroom. At the college level, where I typically see students is, they're just not succeeding academically. And so they'll come into me at times for an interview, and I will take a history, make sure that there aren't any other medical problems or any other psychiatric issues, substance abuse issues. And then what will happen is that I will refer them to a psychologist for further objective testing that's a lot more extensive.
There's drug abuse that happens with these things. I work with college students quite a bit, and it was a surprise to me that it was, I know of people who take Adderall or other drugs for ADHD to help them during finals, and I was confused. Can you explain what's going on?
Sure. Unfortunately, one of the main treatments for attention deficit hyperactivity disorder is medication, and one of the main classes of medications that we use to treat it are stimulant medications, and so those do have a potential or a risk to become abused, and but they don't necessarily have that response in a person that will have ADHD. And so students without the disorder might take them to maximize concentration or pull an all-nighter or something like that. It's very dangerous though. They can become addicting. A lot of students aren't aware either that it's a felony to obtain those medications in that way, so we're trying to do our part to really educate. And
okay, so that might be the reason they take these drugs. What about some of the side effects that are?
So negative side effects of a stimulant medication can cause, it depends on the dose that you would take, but can cause increases in heart rate, blood pressure, heart palpitations, headaches, insomnia, even psychosis we've seen if somebody was to overdose on the medications, and depending on the dose, even death if they were to take really.
Wow.
Yeah.
So it's not absolutely safe to just abuse these things?
No, it certainly can carry a lot of risks.
Okay. Now, people come in, they get tested. Some of these people know how to trick the system. How do they do that?
Well, unfortunately, certainly any of the subjective questions a person could answer in a way that could be misleading in terms of the symptoms that they're having. That's where we will refer out for computerized testing that will monitor more objectively the level of attention and concentration that they're able to perform at. We also will get collateral information from parents, from spouses or significant others. We take a look at grades and how are they performing, and sometimes that's a little difficult to recall at a young age.
Well, okay, if someone's watching right now that may be thinking of abusing these drugs, what would you say in your role to them?
It's a quick fix for really a long-term problem, I think, is what I would say, and really to avoid doing it. I've unfortunately seen some really good, high-achieving students that got in a position where they set goals for themselves that were a little too lofty. They didn't understand the legal risks, and they ended up getting caught. and really ended up with some significant consequences. So I'd say really think about that. And then the safety piece as well. I've seen some really significant reactions that are very dangerous. So.
Sure. All right, well, thank you so much for coming on today for, something that's kind of happening in the background and isn't right in front of everybody's eyes. So thank you for coming on.
Thanks for having me.